describing that she's been having some chronic pain over along the ulnar aspect of her hand and her wrist. It is very difficult for her to feel like she can be able to lift like she used to be able to. Sustained a fall while trail running, slipped, went down. Just saying. Oh, okay, all right. Perfect. But it's just been something that's just been kind of chronic and bugging her, and it's just not getting any better. So one thing I want to look at when it comes to the ulnar side of the wrist is really looking at the TFCC and being able to look at different aspects of the complex. And one of the biggest things we can look at is the peripheral capsule and the disc of the TFC and determine if there's any issues of a tear. Again, the centralized disc, we do not have a nerve innervation, so there is usually asymptomatic. And as we get into our 20s, as they've done studies on this, even in early 20s, we start to even see a tearing away of that central disc. Through the dissection of our wrist, we would all have a little bit of a tear in there, but we don't feel it. It's more of an issue when it's the peripheral edge that could be torn and create an instability. So this last test is the TFCC axial load test. It's described as the ulnar impaction test. I'm going to ask you, when you look at in your book where it describes it, the picture in the book has someone standing and trying to apply the force. Have the patient seated. So in order to be able to determine if there's any issue, any pain at the TFCC, what I'm going to do is I'm going to get your elbow right underneath your hand. I'm going to be able to have that support because I am going to be applying some force, and so I want that force going straight down. I don't want it out here where I'm jamming back, but we're going to be able to really stress the ulnar aspect of her wrist. And again, not to make it sound scary or anything in that manner, but oftentimes as therapists, you will be getting up very close to your patients with this one, and sometimes even the scaphoid shift test. Sometimes trying to keep it lighthearted, trying to say, hey, okay, we're going to get up close and personal for a second here, but what I want to do is I need to be able to make sure my force is going to go right through your wrist like I want it to. So I'm going to be stabilizing the proximal, the distal aspect of her forearm. Very gently, I'm going to let her hand stay in a fist, but the force I'm going to apply is not uniform across the entire top of the hand. More of the force is going to be over here on the ulnar aspect, and she can feel it right now that I'm putting more pressure over her small finger and her ring finger, okay? But if I don't stabilize the forearm, this can turn into a real problem. It can cause a pain that wasn't there before. So what I'll do is I'll get in here and I'll be able to stabilize her distal forearm. Her elbow is supported because it's closed by being on the table. And with a straight ulnar deviation, I'm not extended, I'm not flexed, just keeping a straight deviation. I'm applying axial load and then ulnarly deviating. You feel that pressure? Yeah. It's one that you're not going to twist or turn or anything in that manner, but just being able to compress the peripheral aspect of the TFC, you'll find that it's going to be pain provoking pretty quick. But you want to keep that pressure constant. When I say pretty quick, it doesn't mean that you're going to want to apply the force quick and go and you're done. Apply the pressure down first, and then start to deviate. Okay. It may take getting all the way to the extreme end range sometimes before you can even experience or have replication of symptoms. Okay. So, if you guys want to be able to grab a partner, be able to